Hi, Professor. It's Lakita Masters here for the final presentation of the class. I'm battling a little cold, so sorry if I cough here or there during the presentation. I'm going to share my screen and we can get started. Okay. So this presentation reviews how medication is commonly used across major mental health diagnoses that we discussed in the class. I'll also discuss ethical considerations, limitations of the medication, and alternative treatment options from a social work perspective. So this is pharmacology video presentation. The first set of disorders that we went over in the class was anxiety disorders. Anxiety disorders are often treated first with SSRIs because they're effective and have a safer long-term profile. If those don't work, then they move to the secondary form of treatment, which is SNRIs. And if those don't work, then they go to a third type of treatment, which is benzodiazepines. And sometimes they're prescribed for short term, but they can carry a risk of a dependence on them. Or I guess you can call them benzos as well. Uh, for the alternative therapy to that, I chose to go with CBT therapy, because it's an evidence-based alternative that helps clients reduce or challenge their anxious thought patterns and reduce avoidance. And I just chose to go with the side effects of each primary, secondary, and tertiary medication because it helps me remember what to look for if clients do say that they are on any of these medications. Some of them kind of overlap. So you might have to like ask more questions or like pay more attention to what your clients are going through if they mention side effects. They just kind of see what's going on with them. With the CBT, I like how it works because it's changing kind of how you think and your overall emotions and your behaviors, and it just shows how it all connects and how you can make better changes over time with changing your thought process and the behaviors that you do and your emotions. The second disorder that we went over was bipolar and mood disorders. For bipolar disorder, mood stabilizers are considered the first line of treatment. Usually antipsychotics are often used during acute episodes, and antidepressants, which is the third form of treatment that can be used, can be risky if it's used alone because they can trigger mania in some people. Um, As an alternative to that, psychoeducation and therapy can help clients recognize their early warning signs and support their long-term stability. I also like psychoeducation because it helps the client understand their diagnosis. It can reduce stigma, and it can also improve self-management behaviors and self-care over time. And it's also good even to have psychoeducation around the medication that they're going to be taking if they choose to go with medication, because they might not know what all the side effects and the risks and the pros can be to taking the medication as well. The second set, or not the second set, but the other disorder that we went over was personality disorders. There are no direct medications that treat personality disorder itself. There are medications that may help manage the symptoms like anxiety or mood instability, but therapy is the primary intervention. Usually DBT therapy is especially effective for people with borderline personality disorder because it focuses on emotional regulation, de-stress tolerance, and interpersonal skills. And off to the side here, I hope you can see I kind of listed the different types of personality disorders that there are. Cluster A usually is paranoid personality disorder, uh, schizo. I can't really read that one. It wasn't clear, sorry. Schizo personality disorder and schizotype personality disorder. And then we have cluster B that also describes the other ones, a cluster C as well. We also went over schizophrenia spectrum disorders. Um, Usually, antipsychotic medication is essential in treating schizophrenia spectrum disorders. Also, long-acting injectables help with adherence, and clozapine may be used with other medications. When other medications fail, sorry, that's when clozapine is used. However, medication alone isn't enough. Um, I've seen firsthand how case management, housing support, and psychosocial rehabilitation are critical when it comes to the long-term functioning of someone with schizophrenia spectrum disorders. Next, we have treatment and adjustment disorders. Um, for PTSD, SSRIs are commonly prescribed to manage anxiety and mood symptoms. Medications like Prozac can help with nightmares. Adjustment disorders differ in that they are typically time-limited responses to stress. Trauma-focused therapies such as EMDR or trauma-focused CBT are often more effective than medication alone because they address trauma itself. And if you kind of see off to the side on the left, I listed different types of adjustment disorders. It kind of describes each one. And then to the right here, I listed the different type of trauma disorders that there are. NASW, ethical responsibilities and social impact. The NASW Code of Ethics reminds social workers that we have responsibilities to the broader society. This includes addressing issues with pill mills, overprescribing of medications, and the influence of big pharma. Social workers are encouraged to advocate for ethical prescribing, informed consent, and policies that prioritize clients' well-being over profit. Um, this aligns with what I feel very closely because when it comes to medications, a lot of times clients don't understand what they're taking. Sometimes they don't know there are other alternatives. They're just taking medication. And other times, if they're having side effects, the doctors or the prescribers might not always listen to what the clients are saying. I've seen this personally with um, assistant clients at the doctor's office or at medical appointments, and they're just feeling like, the medications aren't working or they're not helping or they're having side effects. And we have to step in as social workers, as advocates, to make sure that that client's voice is heard about what's going on with them. Medication limitations and alternative treatment, PTSD. Using PTSD as an example, medication can reduce symptoms like anxiety and sleep problems, but it doesn't process the trauma itself. Many clients continue to struggle emotionally even when they're medicated, and trauma-focused CBT and EMDR have been shown to produce long-lasting improvements by helping clients safely process their traumatic experiences. So here, off to the right, I just kind of with just some quick bullet points as to what EMDR does. It says that it uses eye movements and other bilateral stimulation, and it focuses on processing traumatic memories and often requires fewer sessions. While CBT, on the other hand, uses talk therapy techniques, targets changing negative thought patterns, and typically involves more sessions. You can, choose which one you want to go with. And lastly, here are my references that I use for this presentation. Thank you for watching, for listening, and I enjoyed the class very much. Thank you.